knee. That's right. Get up, up. Good God.
Are you pregnant and planning to have a vaginal birth this time after a previous C-section? Here's how you can improve your chances of having a successful VBAC. About 7 in 10 people who try for a VBAC, vaginal birth after cesarean, will go on to have a successful vaginal delivery. And if that's something you're hoping for, here's what you can do to increase your chances. Firstly, understand your own chances of success. So your previous experience affects how likely your cervix is to dilate this time. So for example, if you had a vaginal birth and then you had your baby that had a C-section, you're pregnant again, your chances of a successful vaginal birth in this pregnancy may be as high as 90%. On the other hand, if you had one baby before born by cesarean and in that labour, you had a long labour, you didn't dilate past 4 centimetres, your chances of a vaginal birth this time may drop down to 40%. It's not impossible, the chances are there, but knowing your own risks can help you to make your decision. I recommend that you speak to your own doctor about your own history and they can help you have that discussion about what the chances of success are and the risks and the benefits of all the different options. Next, I recommend to aim for as spontaneous labour as possible. We want to try and avoid induction and hope to get labour started on its own because that's more likely to be successful than being induced. So have your sweeps, stay really active and encourage labour to start on its own. Next, wait as long as you can. Obviously it's a fine balance you want to get the baby out at the end of pregnancy, but if there's no other risk factors, it's a good idea to just wait to see if spontaneous labour starts until around 10 days past your due date. That can increase the chance of spontaneous labour happening rather than say giving yourself a deadline of 40 weeks and if you're not in labour by 40 weeks you want the baby either out by cesarean or induction of labour. Also, stay active and healthy in the rest of your pregnancy. Things like managing your gestational diabetes well, having a healthy weight, preparing mentally and physically for labour can all help in that final stage. And when you are in labour, practice hypnobirthing techniques. Try to stay relaxed but also focused. Stay mobile and upright in your labour for as long as possible and don't be afraid to ask the epidural if you do need it. Many of the factors that affect whether you will have a vaginal birth are outside of your control. So try not to attach too much importance to the outcome. You can try everything to optimise the conditions of your birth, but at the end of the day, a healthy mum and baby are the most important. So talk through your options with your team early. VBAC isn't for everyone, but for many, it is a safe and positive experience when you have the right preparation and support. So how did your planned VBAC go?